Linda Vieira and me. Oh, need me to say that again?
Sorry, Greg. Yeah.
Yeah. This is the Pitkin County Board of Health September 2022 meeting. We have a quorum with Linda Vieira, Bill Madsen, Tori, and me, Greg Poshman. We've had some members out for travel, and actually COVID has taken its toll on one of us. And we've had some retirees lately. So we're thin, but we've got a quorum. So we're going to keep moving. Let's see. In attendance, we have Tom Fritzstein, who's the new alternate. And I'm not sure who else we have for alternates to the board. Jordana, is there anybody else we need to mention before I go into, I want to make introductions just so people know who's who. And I don't see everyone, but.
Yeah, let Tom know. Tom, we've met. I'm Jordana, the director. We've got some staff on here who will help with running the meeting. And then Dr. Kim Levin is also on, and she is our medical officer.
Great, thank you. And then, just want to mention one of our applicants to the board, Barry Ramberger, is attending also today. So thank you. Thank you all for being here. All right, are there any corrections or approval or changes to the agenda that we need to discuss, additions or corrections? That'd be to you, Jordana, if only if you have anything you want to add. Okay. So I need a motion to approve the minutes from March 2022, last time we met.
So moved.
Okay, I've got Tori, and I thought I heard Linda as a second. All in favor, raise your hand. I think we're at anybody not in favor. Okay, we're going to keep moving. Thank you. I'm going to open it up to public comment right now. We're right on schedule. If there's anybody attending who would like to make a public comment, you'll have to raise your hand, or otherwise, if you can talk, you could let us know. And if anyone is there, we'll give them 3 minutes to speak on any topic that's not immediately on the agenda, if that makes sense to all of you. Suzu, who I think you'll have to help me decide if anybody's trying to get through to us.
Yeah, it looks like it's just us here, staff and board. So I don't think we have anyone from the public here today. Thanks, Greg.
Pretty boring times in the public health sphere right now. Isn't that a nice thing to know? Okay, let's see. Let's go right into it then, Jordana. If you could launch in 2023 budget and position requests. And this is, I think, the one item on here that we'll need to vote on.
Yes, thanks, Greg. So what we're looking for today is a recommendation from the Board of Health around the staffing requests and the proposed budget that we'll be presenting to the Board of County Commissioners. Just keep that in mind as we walk through our proposal here. I think our staff will be screen sharing momentarily to bring up the budget presentation slides.
Actually, Jordana, if you're able to, I can put it here in the, well, I'll Slack it to you just because I'll be taking minutes on my end. I was hoping you all can present your own slides if that's possible. Let me just send it. Will that work for you, Jordana? Or I can see if Ariel can maybe put her on the spot and click through slides for you.
Larissa, I'm wondering if you could share slides, and then if you need me to switch out later on, I've got some notes to share. I don't think that they'll be full screen if I do it this way.
Sure thing. Let me pull them up.
Okay, thanks, team.
Right,
While we're doing that, I was just go ahead, Jordana.
I was just going to say we've got some a new staff that just started with the public health department yesterday with our admin team, and so we're pleased to be training him on some of the how to work the Board of Health meeting as we go through today. Thanks, Larissa. So if we move along to slide 5, we like to start our budget presentations with just grounding ourselves in the mission, vision, values, and the equity statement of the Public Health Department. So the mission is to work with communities to promote health and prevent disease by protecting and enhancing environments, policies, and systems that support positive outcomes for everyone. The vision is that systems are in place to sustain a healthy and thriving community. We've got 6 values: health and environment, inclusion and equity, and quality data and lived experiences. And then finally, our equity statement is that we believe in the catalyzing power of equity to engage and enrich our communities as we identify challenges and design solutions together. So whenever we go and do any strategic planning or think about our big picture budget work and positions, we always bring ourselves back to these core principles. If we move along to the next slide, I'm going to walk everyone through the changes to the department over time, because this is really what is able to inform our current requests around staffing. So if you see, this slide brings us back to 2019, where we had 8.25 full-time employees and 1 contract employee in the newly formed department. If we look at the next slide, you'll see that we then went into the 2020 budget year, which is January through December of 2020, and had gone through the process in 2019 to participate in an assessment of our core public health services and foundational capabilities. And so when we really thought about what we needed in 2020 in terms of staffing, we made a number of requests with the effort to right size our department. So you'll see in 2020, we made a number of requests, 5.75 FTE requests. Only 2 were approved in order to help us grow in a sustainable way. But with that is the staffing. If we go to the next slide, that brought us into March of 2020. Which we all know very well as when we really began our COVID response. At this time, you'll see that we had approval to have 9.25 full-time positions, but at that current time, we only had 5.25 and 1 contract staff actually filled and actively working in the public health department. So this really required, if we go to the next slide, required that we add some contract and temporary staff to be able to support that initial COVID response. So you'll see the folks in the light blue and the light green who came in right away to help stand up that response. That brought us through just a couple months of May of 2020. You can go on to the next slide. You'll see that we had a number of COVID-specific term-limited requests that would bring us from July of 2020 through December of 2021, recognizing the huge lift that our department needed to make to lead the COVID response locally. We hired positions from contact tracing to subject matter experts, data managers. We needed some admin assistant support, consumer protection specialists, and an EPR program administrator. So moving to the next slide, you'll see this is really what we looked like from June through November of 2020. We have a number of our COVID folks who are working on COVID. It was really all consuming. It was throughout each of our different sections in the department and a number of different roles. It was still an all hands on deck type of response. We move to the next slide. You'll see that in 2020, we had some supplemental requests to make our finance analyst full-time. To bring that 0.25 up to a 1 FTE would be an additional 0.75. That was approved. as well as repurposing one of our term limited positions to help with the permits around on-site wastewater treatment systems or septic systems. Because as one of the unforeseen outcomes of COVID, we saw a lot of people actually buying houses, doing remodels, lots of construction happening, lots of building happening. And so our department had to figure out an internal staffing plan to be able to help meet that need. So those additional positions were approved at the end of 2020. Moving on to the next slide, you'll see that for the 2021 budget year, we requested a mental health analyst, which is a position that helps with the vital mental health services, which is a project by which the county comes together with the hospital, the city of Aspen, the school district, and soon to be Snowmass, to think about how we can better deliver mental health services in the community. So that work started with us having a staffing person for that in 2021. It's a term limited position that brings us through the end of 2022. And then at this time, we also got approval to have those temporary COVID positions stay on through December of 2022. We go to the next slide. You will see the org chart of what we looked like at our highest number of staff. So you'll see December 2020 to December 2021, really the continued height of our COVID response. During this time, we stood up the 5-star program and then took it back down. We had upwards of 30 staff, varying in times that they were with us, and then when they offboarded. But you can just see the extent to which the department was really focused on responding to COVID and the amount of staff and person power that took. What you'll also notice in this slide is that Karen resigned in early December of 2020, and that is when I was moved into the director position. You move along to the next slide, will bring us to the 2022 budget presentation and what we requested going into this budget year. We requested a planning analyst to help with our community health assessment and public health improvement plan. You'll see that position was approved, and you'll hear from the person who is in that position today and the work that they're doing. We requested a permit tech in a permanent capacity. That was also approved, citing just the need for that position. And then also the extension of the COVID term limits through March of 2022. So those positions that had been approved through December of 2021, we got a little bit extra time for transition and to have those folks on through the end of winter. We look at the next slide. That is what the org chart then looked like from January through March of 2022. So this was really our transition time, knowing that we were going to really start this journey of coming back to what does it mean to be right-sized, thinking about how we go from this structure where we've got, you'll see we still now have COVID staff throughout the department. And if you look at the next slide, you'll see that the transition then gets made in April to downsize our COVID staff team down to 5 positions. At the time, yeah, that's about, there are 5 positions there. And then we still have that temporary position of the mental health analyst over in the PPP department who's working on the mental health funders work there. So that is, this is what we look like today. And then as we move into the next slide, we will talk about what we are thinking that we need to continue this journey to getting us to be right-sized in 2023 and beyond. So I'll share a little bit overall about these positions, but then we'll really leave it to Larissa and Kurt, who'll be presenting about their departments and the positions requested and how that fits into what the needs are to be able to deliver those core public health services and foundational capabilities, as well as meet the needs of the community and the expectations of the work that we need to be doing, the responsiveness and the degree to which we need to be performing that work. So this year we are requesting an epidemiology program administrator. So the goal is to really have that 5-person COVID team shrink down to a 1-person responsible for COVID, but also some additional communicable disease work and epidemiology work starting in July of 2023. We'd also be looking for a health promotion and education coordinator to be starting in January of 2023. And Larissa will talk about this position. There's some, all of these positions I think we're looking to start in July of 2023. The health promotion and education coordinator position is really one that we have seen in some of the COVID work that we've been doing. We've been doing a lot of outreach, a lot of connection with the community, a lot of engagement. And we've heard even across the state that this is something that has been actually a benefit of COVID, something that we have, some departments have been able to do well. And we really want to be able to continue to maintain those connections and continue with that outreach. So Larissa will talk about, what we see that position looking like. The mental health data analyst is a position that we are proposing sit within public health to further the work of the mental health funders group with the vital mental health services, really being able to help analyze what mental health services are being used, what gaps we have, and how better to understand and develop a data collection system for referrals and connections, and then be able to mine that data to learn what we're lacking or what improvements we can make to the system to better deliver mental health services in our community. And then finally, Kurt will be talking also about the environmental health specialists with a focus on air quality, which we are requesting when Tom Dunlop decides to retire. So there's no date attached to that, but we do know that Tom has been instrumental in supporting the Superfund work in the environmental health department and a number of other functions, and that when he is no longer working with public health, we'll have a large body of work that we'll need to redistribute and figure out how to accomplish, knowing that we're going to need some additional staffing capacity to do that. So with that, I'll move to the next slide, which is this proposed organizational structure for July of 2023. So I'll spend just a couple minutes really going through this. So you see underneath the director, we have the deputy director, the PPP manager, and the environmental health manager, who all report up to the director, and they all have their own stat reports. Under the deputy director, we have our admin specialist, our financial analyst, our planning analyst, and then we're proposing moving our permit tech to report up to the deputy director to help align with some of the more administrative functions of that position. and also to help even out the reporting structure here. In our PPP department, you'll see that the proposed number of direct reports next year, there are 4. So our health promotion program administrator would continue the work of our STEP program, State Tobacco Education, Prevention and Promotion Program. Our mental health program administrator would continue the work around coordinating the PACT program, which is where a mental health provider goes out with law enforcement and gets people the care that they need when those law enforcement calls have a mental health component. The mental health data analyst is also in this reports in the PPP department, and then the health promotion and education coordinator. And then finally, you'll see our environmental health department is finally starting to shrink back up in size, with continuing to have 1 EPR and EPI program administrator, 1 continuing environmental health specialist, and then hopefully the requested role of the epidemiology program administrator, who would continue with the COVID functions and some other departmental functions, and then upon Tom's retirement, that environmental health specialist. So that was a lot. I'm going to pause, Craig, see if there's questions, clarifications that can be made there.
Yeah, if anybody has a question, just chime in. Okay, I'm not hearing anything yet. Thanks, Jordana. Of course, budget implications. I'm trying to figure out what does this mean in terms of budget. Thank you for that. It's great to see the recent history of public health has been pretty fascinating and dynamic.
Absolutely. All right, if we progress on to the next slide, you'll see that the capacity assessment, just a brief capacity assessment overview. And as we think about our department, we know that the strengths of where we are currently include some increased staff capacity.
Jordana, we're not seeing a slide, or at least I'm not seeing a slide here. Am I on the wrong page, or something didn't come up on our?
I see it, Greg.
Okay, there it is. Thank you. My fault. Thanks.
Strengthen partnerships. So there were a couple positives to come out of the COVID response. I think one of those is really the way this community worked together and partnered, and we have benefited from those strengthened partnerships with a number of different entities in the community. We've had increased Board of Health engagement, lots of meetings, lots of understanding the powers and duties. We've had our growing department infrastructure. So it really fast forwarded us being able to staff up and get to what does it mean and get to that right size. The community and state prioritization and support for disease prevention and mental health promotion. We hear that loud and clear from our community that these are priorities that we need to be able to address as the public health department. And then increased funding support with a lot of funding coming down to be able to support the work of COVID, and now additionally mental health. There's a lot of funding coming down the pipe. Some of the challenges are that we do have a number of term limited staff that end in the middle of 2023. And we know we need to plan for what happens afterwards. We have limited local data and analysis capacity. We are oftentimes dealing with concurrent emergencies, whether that's COVID and monkeypox or fires and different emergency responses. We are a newer department overall. We have seen high staff turnover across the public health field, and even just in Pitkin County, there is high staff turnover. Limited capacity to pursue large grants because of our capacity, and then also we still don't have the capacity we need for all of the core services and community needs. The core services are those that are required through the Public Health Act of Colorado. And community needs are those that are identified through various assessments and surveys. Most recently will be our community health assessment and then public health improvement plan, which we know that we'll need to be able to address whatever priorities come out of that. So if we move on to the next slide, I just wanted to walk everybody through the capacity assessment around the foundational capabilities and services that these are the foundational capabilities that we are required to be able to assure within the public health department. What you'll see listed here down the left-hand side are all of those foundational capabilities. So assessment and planning, communications, policy development, partnerships, emergency preparedness and response, organizational competencies, and health equity and social determinants of health. What you'll see on the right-hand side is the capacity ranking on a scale of 1 to 10 of, as a department, what did our capacity look like in 2019? What does it look like currently? And what would it look like in July of 2023, even if we are able to get the positions that we have requested? So what you'll see here is that, on a scale of 1 to 10, we still don't have all of the capabilities that we need to. It's a challenge for small rural public health departments across the board. But what you'll see is that currently from 2019, we have increased in certain areas. The numbers in green indicate an increase in our capacity. So communications, policy development, partnerships, and emergency preparedness and response and organizational competencies, we've grown in our ability to address those. We have shrunk in our ability to address health equity and social determinants of health, as well as assessment and planning. In July of 2023, if we even can get the positions that we are requesting, you'll see that we continue to even decrease in some of these areas as we are suggesting an overall decrease in the number of staff that we have in the department. If we look to the next slide, these are the foundational services, again, that we are required to assure and be able to provide in the community around communicable disease prevention and control, environmental public health, maternal, child, adolescent, and family health, chronic disease injury prevention and behavioral health promotion, and access and linkage with healthcare. You can see again our scores in 2019, our current capacity, we've grown in several areas, and then expect a bit of a bump in the maternal child's health, chronic disease ability and access and linkage with care, and also around our communicable disease prevention and control. Expect with going from a team of 5 down to a single shop to address some of the COVID work, and that we'll be losing some capacity there. So, I think what this really illustrates is we're still trying to get to that right size. We're trying to do that responsibly in a measured way. Greg, to your point, we know that each full-time staff that we add adds continual budgetary considerations, but that overall we're really looking with how we need to get to that right size to be able to provide these services in our community and be responsive. So with that, I'll just pause again to see if there's any questions before I go to the next slide. If not, okay, we're going to walk through the 4 different areas of budget. I'll start by walking through our administrative budget. And this is really, Greg, this is a preview because we'll be presenting this again to the Board of County Commissioners. And so what we're looking for today is really that recommendation from the Board of Health. What we start off by sharing are the foundational public health capabilities. So these will look familiar, but specifically listed on the slide are those foundational public health capabilities that the administrative department is responsible for. Looking to the next slide, we will share the proposed changes to the 2023 budget based on our current year's budget. So we have some increases in one of our core public health services contract from the state. But we also have a decrease in some of the preventive block grant funding that we have received. We're continuing to pursue an application for PPP, and Larissa will talk about that application. As far as expenditures go, we do expect to see a decrease in the staffing. If you remember, we had 3 months of the data analyst and administrative specialist positions from January through March that were covered under the admin budget. And we are not, we won't be seeing those staffing needs in 2023. We go to the next slide. We'll share some of the big rocks. So when we think about our admin department, some of the goals that we will be working on in 2023 are to complete our 5-year public health improvement plan, to build upon the communications infrastructure created through COVID, and strengthen the department's overall communications. We will expand our internal and external equity work to align with our values, as well as the state and federal funding requirements. And finally, to invest in the health and well-being of staff to promote a positive work environment and increase staff retention. And you all will probably remember us coming and talking about, one of the strategic areas that we've been working on in our internal strategic plan is around staff retention, positive work environment, to really address the implications and impacts of working on a pandemic response for a couple years now. So that work will continue into 2023. Larissa, would you like me to share the slides as you go through?
Nope, that's all right. I can continue sharing if that works for you.
Thanks.
All right. Good afternoon. My name is Larissa Bonilla, the Planning, Prevention, and Partnerships Manager. My name has changed in the last few months, so you might know me as formerly Larissa Dandino. So I was married in May, which is why my name has changed. And so I will, sorry, Greg, you came on mute.
Just wanted to say congratulations.
Oh, thank you, Greg. All right, so I will give a brief overview of the PPP department. And so in the PPP department, the areas of work are really centered around 3 foundational public health services. And those include the chronic disease injury prevention and behavioral health promotion, maternal, child, adolescent, and family health, and access to and linkage with healthcare. And the department is currently composed of a team of 4, as you saw in the org structure, which includes myself as the manager, the mental health program administrator, the health promotion program administrator, and the mental health analyst. And these team members oversee 4 different programs, which includes the State Tobacco Education and Prevention Partnership Program through CDPHE, the Child Fatality Prevention System, the Picken Area Co-Responders Team, also known as the PACT program, as well as the Vital Mental Health Services, which is that IGA between the county, ABH, Aspen Valley Hospital, Aspen School District, and the city of Aspen. So looking at some of the changes to proposed changes to the 2023 budget for the department include a few increases, which is great to see. There'll be an increase of about $12,970 due to some increase in Amendment 35 state tobacco tax revenue from CDPHE awarded through our STEP grant. And then due to this increase in funds, we were able to cover 0.88 FTE of the health promotion program administrator position, which is up from 0.75 FTE previously. So we are able to cover additional cost associated with the position with additional grant funds, which is great. Also, the harm reduction grant administered by CDPHE for the PACT program increased just about a little under 16,000 for the 2023 fiscal year. And then the child fatality prevention system, which is a statewide legislatively mandated multidisciplinary and kind of multi-agency network that's used to review all child deaths as well as look at preventative actions to help prevent future child deaths. And this is funded by CDPHE as well, and that increased by $50. Not significant, but still good to see an increase. And then in our also for our PACT program, the Behavioral Health Administration, formerly known as the Office of Behavioral Health, co-responder grant increased by about 9,421. And both the harm reduction and co-responder grant programs still no longer have a sunset date. And so those are expected to continue indefinitely. And then finally, the Vital Mental Health Services IGA, we are anticipating to increase by about 100,000 thanks to the very generous contribution from the town of Snowmass Village. And moving into kind of some of the expenditures, there are a few proposed increases, mainly associated with positions. And so the first is that we are requesting that one new FTE Health Promotion and Education Coordinator. And this position would maintain some of the functions that the COVID-19 Communications and Community Engagement Specialist is currently doing, while also allowing the department to increase capacity to fulfill some of those 3 core public health services that were mentioned in the previous slide. More specifically, this position would collaborate with different public and private sector representatives. They would develop and disseminate health promotional materials such as infographics, fact sheets, posters. They would create and deliver educational presentations, provide technical assistance to community stakeholders on a variety of health topics, help with interpreting public health guidance provided by local, state, or federal partners, drafting public health policies, and engaging community partners in health promotion activities. And so there's a breadth of functions that we foresee this role to fulfill, as well as maintaining some of those really beneficial functions that we saw during the COVID-19 pandemic. And so while we don't have full grant funding to support the position at this time or to support the full cost of the position, we are actively searching for potential revenue sources and did just receive notification of a $19,000 grant we're being awarded from the Office of Public Health Practice Planning and Local Partnerships, or OPHP. Additionally, we do receive a maternal and child health annual allocation from CDPHE. The funds for 2022 and 2023 are currently being used to support our community health assessment and public health improvement plan, but there is the opportunity to reallocate those funds in the future. And then also be requesting the mental health data analyst position that Jordana mentioned. This would again be a 2-year term limited position to help with ongoing mental health data collection and helping to build that robust mental health system. And this position would be fully supported through the Vital Mental Health Services IGA. And lastly, moving on to the big rocks for the PPP department. We have seen some data from the most recent Healthy Kids Colorado survey that show a decrease in youth vaping across the region. However, Pitkin County continues to have higher rates of youth vaping compared to the state and the region. And so we're really refocusing on our tobacco prevention efforts. And so we want to focus on providing education and technical assistance to advance tobacco control policy in the county, promoting and assisting in the implementation of comprehensive tobacco-free school policies throughout the county as well as throughout the Roaring Fork Valley, and creating a system for consistent and routine tobacco retailer compliance checks as the COVID-19 pandemic created some challenges around consistency with this. And then related to our program, PACT program, the team wants to work on streamlining the process for data collection, analysis, and reporting, as well as creating a sustainability plan for the PACT program, seeing how successful it is and how beneficial it really is to our community. And then finally, as we have all heard and talked about many times, another big rock continues to be around supporting mental health and helping to build a robust mental health system that improves coordinated care, patient navigation, and referrals. And I will pause here to see if there are any questions for me before I hand it off to Kurt to present the disease investigation and environmental health budget.
I just had a question in regard to the $100,000 that Snowmass Village is putting in. We're basically allocating those dollars from our tobacco and marijuana tax. And I think we still need an updated IGA, but I mean, the idea is really to put those dollars towards mental health, right? Because that seems to be the real need right now.
That's right, Bill. And you know, the proposal of what those funders together are going to be funding is not only some services that go right out to the community, so mental health therapists in the schools, some community-based mental health therapists, as well as integrated therapists in an integrated care-based setting. So where in an office setting where they might be getting physical health care, also being able to pop in next door and get mental health care. The new part of that program is really working on this system to improve coordinated care. So what we've continued to hear through our assessments is that there are a lot of services, but the individual patient experience, there's not a great way to go from one service to the next. If you might need something, you don't quite know where to go, and there's long waits. So we think that if we take a stronger role in helping to facilitate that coordination, navigation, and referral process and build something through really collecting and analyzing that data, that might be a system that we can then figure out, get it working really well, and then put it out to the community through an RFP to say who wants to continue, managing and shepherding this process as we move forward. So a condition in what we're writing through in those, if you're going to be getting money to provide those services, you're also going to have to be participating in the coordination and data collection efforts, which we think are going to be the, hopefully, secret sauce in getting us to move up to that next level.
And how does Mind Springs fit into that equation?
They currently are awarded one of the contracts or two of the contracts through the RFP process. They would be open to be able to bid on these new RFPs as we open them up to see who in the community will be providing those services in 2023. But it will be an RFP process. So any mental health provider who can meet the proposal is invited to submit a proposal.
Okay, great, thank you.
Hey, Jordana, well, thanks for bringing that up, Bill. Just wondering, what does the field look like for players who might actually respond to an RFP like this? If maybe Mind Springs, maybe Aspen Hope Center, would Mountain Family Health have any capacity? I wonder who else is out there that I'm not thinking about.
Yeah, Mountain Family Health is currently who's providing that integrated care services. There may be some other practices, who would be interested in applying and doing it in their work. But those are the main players that we're aware of. let's see, Recovery Resources does some case management and some work with peers. There are some aspects of that in some of the proposals. So there could be a number of different players who would respond to with proposals.
Got it. And even individuals like practitioners could participate in this on some level, local practitioners, if they had the bandwidth, of course, and if it made sense. Yeah. Thank you. Anything else, Bill?
Okay. Good afternoon, everybody. Kurt Dahl, the Environmental Health Manager. And today I'm going to present on both disease investigation and environmental health budgets. As you remember from the slide previously from Jordana, disease investigation is under environmental health. So we'll start with that one. Next slide, please. So areas of work. Communicable disease prevention, investigation, and control. I say that's a integration, I should say investigation. So when we have a communicable disease in the county, this is the team, this is our responsibility to investigate it and then take measures to control it if necessary. So the programs that we have under this, the COVID-19 pandemic response, this is the term limited team that we've hired. Currently 5 staff that we have through June 30th of 2023. That includes our Epi and COVID team manager, 2 COVID specialists, our testing and vaccine coordinator, and then our communications and public engagement staff member. So their primary responsibility, again, is addressing the pandemic response currently. Another program is communicable disease investigation. This role is shared amongst several of us. Previous to the pandemic, we had a 1/2 epidemiologist, 1/2 emergency preparedness staff member. They work in part on communicable disease investigation. We share some of that with the state health department. And then we also have our COVID response team that helps with that. If you think about monkeypox as an example, the state health department started out with
Hey, Kurt. We were able to hear most of what you were saying, but maybe turn your camera off so that you have a little bit more bandwidth on your connection. If you can hear me.
yeah, can you hear me?
Yep, we can hear you.
Are
I
you
think
there?
it's a
Okay, thank you.
yeah, it's a little fuzzy. So if you're able to turn your video off, that might help with the sound.
Okay, apologies, I'm traveling, so I'm sitting in the middle of town, but apparently my cell reception is very good. Did that help, Suzuho?
Your video is still frozen on our side, but yeah, let's give it a try and see if we can continue to hear you.
Okay. And hear about monkeypox, or do you need me to repeat that?
Okay, I think we're losing him. This is going to be pretty tough. I hate to do this, but I'm just wondering if anybody can pick up for Kurt since he's in a bad connection.
All right.
Yeah.
It's strange. I'm sitting actually, we only made it as far as Carbondale. So the notion that I have a bad connection is interesting. Can you hear me now?
Yeah, we can hear you now. Thanks,
Yeah.
Kurt.
Okay. Apologies for that. Let me see if I can get through this. The other piece of the disease investigation program is zoonotic disease. Think of things like rabies. I know when we talk about submitting bats, that's an important aspect, and we share that responsibility with the Environmental Health Department and other zoonotic diseases. Next slide, please, Krista. So a couple of changes to the revenue. Since the 5 temporary positions were approved, we had an opportunity and have received a CDC Workforce Grant that will help cover the costs of our COVID team through March, and then the general fund will cover them through the rest of the portion of their term through June. Obviously, we're continuing to look for opportunities to help with covering that additionally. If they come up, we'll apply for those. We're also currently spending down the last portion of our immunization grants, number 3 and number 4. For expenditures, as we talked about, the term limited team through June 30th of 2023. But that doesn't mean that COVID's going to end in 2023. We know that that's going to continue, as well as other emerging communicable diseases. When Jordana was at the Aspen Ideas Festival, one of the things that was shared that she brought back to our team is the expectation that we're going to continue to see other communicable diseases being spread more consistently, and we'll have to respond to those more often than we have in the past as we expand our interface between the human environment and the wild environment. That interface area presents those opportunities. So with that, we're asking to bring a full-time epidemiologist on to address those needs. It also will allow us to coordinate for better local response and address a number of these emerging diseases. COVID is not going to go away. That will be around, and we'll continue to need to respond to that. We have monkeypox, and there will be others. Next slide. So the big rocks, really it's looking at this transition coming up, right? We know we're going from a staff of 5, hopefully to a staff of 1, with that half as well to support that epidemiologist, the current position. And that's a big rock, understanding how we're going to address that as we move forward, losing capacity, and also if we have staff that leave before this June 30th and dealing with this attrition, how we're going to address all of those capacity pieces and still meet the expectations of the community, our department, and the state health department. So I believe that ends the disease investigation portion. Are there any questions?
I'm not seeing any questions here, but they may pop up. People can feel free to jump in if something occurs to them, but let's keep moving. Thank you. Thanks, Kurt.
Okay. Thank you. All right, on to environmental health. Next slide. So environmental health, foundational services are environmental public health, the different programs that we have. So we have a water quality program, and we have an environmental health specialist that works very specifically in our water quality program, that works on the OWTS program, the septic system program, and permitting, supporting out those efforts. We also have a groundwater protection program. We're partnering with a number of local agencies around a Keep It Clean program that had been put on pause during the pandemic, and we're now in the process of regrouping, and you should be seeing materials coming out from all of us soon. Air quality program, we have a very small and limited air quality program. Our environmental health specialist really takes the lead on the radon program right now. Hazardous materials, Smuggler Superfund site is the major portion of our work under hazardous materials. That is our Superfund site manager, Tom Dunlop, who is a contract employee. And his function is really managing that and then providing additional expertise. Zoonotic disease investigation. So again, when we're looking at those diseases, zoonotic disease being diseases that are spread from animals to human. Environmental health works alongside with disease investigation in terms of that investigation and control with the zoonotic disease. Emergency preparedness, again, our half emergency preparedness staff member falls under environmental health. We do a number of complaint investigations around anything related to the environment, from trash to noise to water, odors, things like that. And then we do have a noise ordinance that we enforce within the county, but not the jurisdictions of Snowmass Village or Aspen. They have their own ordinances. Next slide, please. Okay, so revenues. Potential increase in revenue. Right now, we get a straight pay radon grant for $5,000. There are opportunities with radon grant to go up to a $25 or $25,000 grant. And that would really be contingent on if we get this air quality specialist. We could look at expanding the radon program, and that program would then, the costs to that program, we could offset with additional funding from a grant. So that's a federal grant, so it's a little strange in terms of the process because that grant runs from October through September. But again, knowing that the air quality specialist is contingent, we should have opportunities within the next year to apply for that to help offset some of those costs as we look at expanding that program. Decrease in revenue. One of the expenditures that hasn't occurred in the past that you'll see is we have not been paying for the software portion of our permitting system that we share with ComDev, or ComDev shares with us. Then this next year in 2023, we will start paying for our portion of that, as well as any technical service fees that we would have associated with that, or any consulting fees that we would have. So that's an expenditure that will come out of this next 2023 grant. And obviously, again, a big expenditure is the proposed environmental health specialist. They would be working mostly in air quality, although again, there would be some general environmental health crossover addressing complaints and other programs. The big pieces that we're looking for out of this person would be expansion of the radon program from what we currently have to do more follow-up with folks, help coordinate with people who have high radon with getting mitigation systems installed. Working more with the state health department. There's some cost coverages the state health department has that we just don't have the staffing right now to help coordinate and take advantage of. The PM10 program, we had previously been in non-attainment for PM10. I believe that most of you are familiar. We've been maintaining the PM10 filters on top of the yellow brick building for the state health department. In the next couple of years, that compliance requirement will cease, but it won't change the fact that we're going to need to continue to work on ensuring that our PM10 levels stay down. And so that will be coordination with the city of Aspen as well in their program, as well as expanding that out to PM 2.5. If we think about wildfire smoke, that's what contributes to PM 2.5. And so we've had a number of instances over the last several years where we've seen that smoke and haze come in. And so we would like the staff member then to really look at that program, think about things like clean air shelters, think about warnings, and expand that program out to really educate people on what to do. Open burn permits, that's something that's issued by the fire department, but there's also an air quality aspect that we'd like to start working with our fire departments on. Updating fireplace regulations. And then the other piece really is around working in coordination with both other county departments and the city of Aspen and Snowmass Village in climate change work. If we think about climate change, there are a number of aspects that have to do with policy advocacy, data collection, and looking at sustainability and mitigation. And when you think about it, a lot of people, what is public health's role? And public health role really is that when we think of climate change, the impacts from climate change, you're going to feel that in your health. That's where we're mostly going to notice it. And that's where everyone will be impacted from it, from, again, air quality from wildfires to water issues, whether it's quantity or quality issues, differences in vectors. So right now, we don't see a lot of mosquitoes that spread West Nile virus. As that temperature warms, there's concern about that, those mosquitoes being able to expand their range. And so we want to monitor more for those types of vectors. And then we also have other rodent vectors that potentially could create issues for additional burden of disease. So there are a number of pieces that we can start looking at and coordinating with others around climate change that we haven't been able to do in the past. Next slide. All right, thanks, Melissa. Big rocks. So as Jordana mentioned, we are anticipating at some point Tom will be retiring. We're hopeful to have him as long as we can, but recognizing he will. We're looking at transitioning the Smuggler Superfund manager role to our current staff. We're already working on, Tom has put together a transition plan. Brian will back me up as a secondary, and Brian has already done some additional training that's needed to work on the Superfund site. Again, as we've talked about, looking at how we're going to address the needs in air quality, we're looking at an additional staff member to do so. Again, with the climate change role, looking at taking a greater partnership with all of our other agencies around addressing climate change, and especially the resiliency and mitigation and advocacy piece that we feel really strongly about. We're also looking at our emergency preparedness, our public health emergency preparedness coordinator, and expanding their role, recognizing that we'll still have them in epidemiology to an extent. We also want them to do a much more thorough job with assessing our plans and updating our response plans. When the pandemic started, we found that those plans just really didn't have the detail that we needed. So we're looking for them not only to do a better job of really getting additional detail in those plans and helping to coordinate the various agencies that we partner with during a response. It's also about training our staff. We really are looking at trying to up the training of our staff. This would fall under that person as well. And then the last piece is something that will start in 2022, and then we'll come back to you likely in 2023 with, and that's looking at our environmental health fees. We changed our environmental health fees a couple of years ago just to address some opportunities to change the OWTS fees. And at the time, we didn't really have an opportunity to think of it with an equity lens. And so one of the things that we're going to start looking at, which is a little outside the box for environmental health, is how can we build in equity when we think of our fees and think about what those fees who they might be excluding and how they might be impacting people. And then we will come back to the Board of Health once we've had a chance to do some research and make some recommendations to the Board of Health. The Board of Health is actually the body that's responsible for setting environmental health fees, although we would also want to do a presentation to the Board of County Commissioners, knowing that they're the ones that actually control the budget as well. So there's a duality to that. And I believe that was the last slide. Any other questions?
You know, if I could, my question is just regarding the Smuggler Superfund, how it's been going now for, I don't know, is it 30 years or maybe longer? Tom's been there the whole time. What does
A little
it
longer than that, 40. Yep.
So what does that entail? And it, you know, I guess my uninformed perspective is that it seems like a pretty stable situation. So what actually has to be done up there on a regular basis for a 0.4 FTE? Thanks.
Oh, thanks. And it's a good question. So anytime we have development and you move 1 cubic yard of soil, there's a permit that's required. And we work with the city environmental health and engineering departments to coordinate that movement. And then if any soil is hauled off site, the only place that it's allowed to go is the Pickens County landfill. And so we're coordinating the efforts around making sure people are getting their permits, doing some education. There are biannual requirements for us to submit reports to the EPA on any activity that's gone on. We also ask the EPA to sign off on a clean letter if they do that. We have an annual letter that goes out every year to the Smuggler Superfund site owners, property owners. We've talked with the EPA about whether or not that's necessary, and they have indicated that they want us to continue to do that through perpetuity. So the other piece that we do is take a monthly drive through the site, just looking to see if there are any issues, anything coming up where we're seeing people move soil and making sure that they're getting their proper permits and then making sure that that's all getting communicated to the landfill. If the landfill is going to be receiving soils, that's something that they need to know about.
Yeah, great. Thank you for that. I'd be interested at some point
So-
to see what the soil analysis looks like, for the soil that's moved. It's been happening almost, most of my adult life, and I just like to understand. It's hard when the EPA demands we do something in perpetuity. And I don't know if that's appealable or necessarily appealable, but I don't get this impression that this is a major threat to the public health here. But it could be my naive, I've been ignoring it for all that time as well. But thank you. Maybe we can have a further conversation on that another time.
Yeah, I'd love to, because I think there are a number of pieces there that unfortunately we appealed the decision to the EPA, and that appeal was denied. And Tom can go into large detail on the aspects, but because of that appeal and the losing of that appeal, unfortunately, yeah, it has to be run through perpetuity. There is a map, Greg, that we create, we update every year, that shows there were over 1,000 soil samples taken back when this was first discovered. And as people clean up their sites, we will update the map. But there is a map out there that you can at least look at that shows where those contamination levels are.
Oh, great.
But we're also anticipating a lot of work with Centennial redevelopment. Sorry, I'll stop there. But we can talk more about it on a later date. Love to talk about it more.
Great, thank you. Okay, where to now, Jordana or Kurt?
Any other?
Yeah, okay, here we go.
I am. Thank you.
There's no other questions. We'll just move on to looking at some of the budget numbers. So what we have to share with you on this slide are our financials for this year, 2022, as of quarter 2. So that's as of June 30th. What you'll see is, at halfway through the year, we'd expect to be at about 50% of what we're seeing used, of revenues coming in, and of expenditures. For revenues, we are right on track at about 52%. A general fund transfer will happen later in the year, so you won't see that booked yet. And that the tobacco taxes that you see up under revenue, you'll see that the year-to-date actuals are very low for what we would be expecting at this time. They are a bit down, but the major factor in that is that a portion of the 22 tobacco taxes were booked into the 2021 budget and figures. So this year will continue to show less than actual revenues. So we're accounting for those, just understanding that that's a part of what we'll see in the budget this year, and we've used that to help understand what we can really be expecting in 2023 for revenues. When we look at the expenditures, you'll see we're a bit over budget for halfway through the year at 59%. Payroll is running high. One factor there is that some term limited staff had left. As we talked through, there were a number whose terms were up in March, and they had PTO that they had stored up and were able to pay that out. That wasn't budgeted for. So we have learned from that and know that we will be expecting some PTO payouts in 2023 and have adjusted the budget to account for that. The totals here also include the encumbrances, which are the contracted amounts that are yet to be paid, as well as overhead that was booked for all of 2022, even though we're only halfway through the year. So just some more explanations of why that number looks a little bit high with the expenditures. The admin costs we recognize is high due to overhead, which is calculated based on the prior year's activities. which we know was higher than budgeted due to COVID and staff increases in turnover in 2021. So the final point here is just that some of the expenses are for grants, which we have yet to receive reimbursement. So if we're getting reimbursement for the cost of a grant that happened in May, we have to wait for the end of May, and then we collect all of our costs and invoice the agency that's providing us the grant, and won't actually get those funds back often for several months. That is where we are at for 2022. Any questions on this budget? If not, I'll move us along to the next slide, which is our 2022 budget and 5-year plan. We see that we know we'll have an updated figure with our more accurate 22 budget and 2023 budget for the presentation to the Board of County Commissioners. But in order just today to give the board the ability to either recommend or not our budget to the Board of County Commissioners, we wanted to share what the overall strategy and plan is. So our 2023 budget is very similar to our 2022 budget. You'll see that salaries and wages are expected to decrease as our staffing continues to come back down to get right-sized. The other major impacts here, you'll see the transfer from the general fund will continue to receive, as well as transfers from the Healthy Community Fund. We do get 22% of that Healthy Community Fund tax that comes into our budget. And overall, we do plan to maintain a balance in the fund, but know that the Public Health Fund is backed up by the Pickens County General Fund, so that there's not as much of a requirement to have as large of a fund balance as we did carry in 2022. So again, if there's no questions, Greg, I'll move us to the next slide, which really is where we can get the Board of Health recommendation for those position requests, that staffing proposal, as well as the public health budget. And this, the recommendation that we're asking for from the Board of Health is what we will bring forth to the Board of County Commissioners, as they will make that final decision around these positions, as well as the budget allocations.
So Jordana, is this something we do at one at a time, or is this a package that what form would you like us to make to vote on this?
I think that, we're, package is fine, Greg. I would ask, maybe if you want to open it up and see if there's any comments or concerns with recommending these positions. And then we can address that before moving forward. If the board isn't comfortable as a package, we can go through one by one.
Got it. Thank you. Yeah, I'd love to, if anybody wants to chime in, please do. I can't see everybody on my small screen here, but we can certainly entertain questions or comments. When this comes to my board, I can say that our board does scrutinize it. I think the big fear always comes up whenever we have requests for more employees or greater budget items, only that, if we become recessionary in the economy, then the hard work of laying people off unexpectedly has to happen. And that's all. I know that's in the back of some commissioners' minds all the time. And then also just looking at the general growth of the county staff and budget. So I know that'll be front and center as we're looking at all this. And I think everybody would be really grateful on the Board of Commissioners to have the input and the perspective of the Board of Health members, individually or together. But it seems like what we're being asked to do here today is, approve that this go forward as it has been put together by our capable public health staff. And so it moves the conversation forward, but I really do want to invite comment, questions, and perspective from all of you. Thanks. So I'll give you a little time if anybody's thinking of asking a question. There's so much information here that it may just not be at the appropriate time, but it seems like this would be the time to do it. I did bring up the air quality and Superfund site just because that has been ongoing for so long, and it's always good that we understand what and if the problem exists. And when you think of a 40-year half-time full-time employee for something which I guess they're still questioning the community whether or not that is the most important or use of our resources. Given the mandate from the EPA, we don't really have much choice, but just wondering if there's an opportunity or something else we should be doing to look at this and address it, to confirm there is or isn't a problem and what we should do about it if there isn't. And I know as Bill brought up, we have mental health issues with in the community that need, it seems like we need to focus a lot of attention on that. When you say that COVID isn't over yet, I know people on our board have it now, so that's right. It's been easy to ignore lately, but it's still happening. If we have the staff budgeted through 2023 June, I guess we'll have to decide later what happens beyond that point. But I'm at the limit of my ability to comment on any of this, but I still want to just leave it for if anybody has a particular comment or suggestion they'd like to make to the board, this would be a good time. Okay, so if I don't hear anything, I will ask.
Hi, Greg.
Okay, we got somebody there. Okay, who's that?
It's Tori.
Thanks, Tori.
If the process here right now is for the Board of Health to vote on forwarding this budget to the BOCC with our recommendation of approval, I don't feel like I've had enough time or discussion to really get deep into this. I think that there's on the surface no glaring questions that come to my mind, but as far as budget discussions go, I would pull this apart in depth, probably over a meeting that's longer than an hour and 15 minutes if I was really gonna kind of have some insight there. So I don't know that I know this budget well enough to endorse it. But do I endorse the staff that has put it together and trust in them 100%? Do I really tell you what I most appreciate, or what really made the most sense to me was the organizationals that are included in here. And so when it comes to the personnel or FTEs, yeah, I feel very comfortable with what's been presented here. But as far as any other details into different areas of this budget, I don't know that I can really process all of that quickly.
Great, thank you, Tori. I appreciate that. Was very articulately put, and I tend to agree. It's the kind of thing that I can imagine spending a lot more time with, as you've suggested. Any other comments?
Well, I would imagine that the Board of County Commissioners is going to take a much more in-depth look at these positions. I mean, if you need a thumbs up from the Board of Health, I mean, I'm happy to support the staff's position. But to Tori's point, I mean, I think it is a lot to digest.
Right. Thanks, Bill. I appreciate that. Yeah. So that's Jordana. I think that we should have a brief conversation now on clearly the BOCC is going to need to spend more time with this, with you, and I'm comfortable doing that. So maybe this is the time to just recommend that we move it forward. But I wanted to make sure everybody had a chance to say something and leave it open. If, before the BOCC sees it and considers it, I think we'll have other opportunities as well.
I just wanted to make a quick comment,
Yeah.
Greg. Oh, yeah. I thought it was amazing looking at Jordana's, where we've come, just like an overall historical view of everything, of where this board has come and where the Department of Public Health has come really over the past 5 years, and looking at all the personnel changes and everything that's so rapidly happening. But I would personally support keeping the Department of Public Health as increased and buffed up as possible, and support all of these positions to do the work that we really need to do in the community.
Thanks, Kim. That's Dr. Levin as our Chief Medical Officer, providing some perspective on this. So if any of our other board members would like to comment, or anybody else on the call for that point, we don't have a huge number of people here. If anybody else has perspective on this, I think I would just ask for a motion to approve this as presented and move it toward the Board of County Commissioners. And then I'll know for sure that I'll have a chance to see it again. You'll have to unmute if you want to make a motion, if you're ready to do that.
Yeah, I'm happy to make a motion to move the recommendation onto the Board of County Commissioners.
Thanks, Bill. I'll need a second.
I second it.
Okay, thank you, Linda. Any other comments from anybody? Okay, I'm going to call it. All in favor. Hopefully, Suzuho, you can see everybody. I can't.
I can, we're good, Greg.
Actually, raise your right hand. There's all four of us. So thank you. We're going to move this forward, and thanks again for the in-depth and well documented presentation. It's helpful, and it's going to take some time really to wrap our heads around all of this, but I think you're doing great. So Jordana, what do we have next here?
Before we leave that, along those lines, this will be a process that we'll go through every year with bringing the budget and any position requests to the Board of Health in order to make a recommendation to the BOCC. Tori or Bill or anyone, can you share what you would like to see, if there's any changes or anything else you would like to see as we go and do this next year, to be able to give you more information or time to digest and understand and ask the questions that you need to ask?
Yeah, so the invitation is open, I think, certainly.
I can
Okay.
give those to you. Absolutely.
Great, thanks, Tori. I think we're ready to move this on to the CHAPS, Colorado Health Assessment and Planning System Update. And Ariel is here.
Was the first motion?
Did you get what you needed back on that last?
You all
on the
hear me okay?
Yeah, we can hear you. Thanks.
Turn up your sound. All right, technical difficulties. Can you all hear me?
I can hear you.
Okay.
I want to make sure everyone else is muted. Thanks.
I'm Ariel Holstein. I'm the planning analyst. I just started at the end of March, so this is my first Board of Health meeting. I'm here to give you an update on CHAPS.
Welcome and go ahead. Looking
Thank
forward
you.
to it. Thanks.
So a little bit of background. Jordana mentioned the Colorado Public Health Act of 2008 earlier, but one part of that act was mandating that all local public health agencies in Colorado participate in CHAPS. This is a 5-year cycle that has 8 phases. The phases include plan the process, equity and community engagement, conduct a community health assessment or a CHA, assess capacity, prioritize issues, develop plan, implement, promote, and monitor,
and participate in statewide public health improvement opportunities. So where we're at now, the community health assessment is done. The report is almost finalized. There's a couple more revisions to be made, but it should be available soon. In the next steps over the coming months, the end of the calendar year, are to assess capacity, prioritize issues, and develop a plan. Next slide, please. Thank you. So for the community health assessment, we use the BARHI framework. BARHI is Bay Area Regional Health Inequities Initiative. And in addition to focusing on more traditional public health measures like smoking, physical activity, nutrition, disease, and injury, it also looks at social determinants of health, or things more upstream that affect people's health that are not necessarily behaviors. So things like the environment, housing, transportation, social inequities, laws, policies, all kinds of stuff that affect health. Next slide. So for the community health assessment, quantitative data and qualitative data were used and then mapped to the BARHI, depending on where it fit in that framework. So we started a partnership with the Colorado School of Public Health, I think a little less than a year ago. It was before I started. I don't know exactly when it began, but we worked with community health assessment students in the spring 2022 semester, so January to May. In the students, and I reviewed existing secondary data and then mapped it to the BARHI. So they looked at some and I looked at some. And then for the qualitative data, that was all primary data and it was collected in 3 different ways. So the students conducted 9 key informant interviews with organizational leaders in Pitkin County and the Roaring Fork Valley community. Those were about climate change, mental health, and Hispanic and Latinx equity. And we also hired 3 community contractors through the health department who also collected data. So they conducted key informant interviews as well, a total of 21, 17 in English and 4 in Spanish. And those were with community members who they chose to interview. Again, those interviews are about the same topics of climate change, mental health, and racial equity. And those same community contractors also participated in Photo Voice about climate change, mental health, and racial equity. Next slide, please. So I know Photo Voice is not a super well-known method, but basically what it involves is giving people cameras, or if they have their own cameras, which is the case in this project. People take photos of a specific topic in their community, but they not only highlight challenges, they also highlight assets in the community. So looking at what needs to be improved, but also what resources are already there that can be used and built upon to improve health conditions. And then in addition to taking photographs, they used the SHOWed framework to provide write-ups of each photo, explaining what was happening in each one. And SHOWed just stands for, what do you see here? What is really happening? How does this relate to our lives? Why does this condition exist? And what can we do about it? Next slide. So a couple of things before we get started. First, I just want to note this is a really condensed version of the CHA. So there's a lot more data in the full report than I'm going to talk about here. And second, I just want to let you know I'll be showing data about disparities between different populations. And I want to make it clear that poor health outcomes in certain populations are due to just the systems existing in our society and how they interact with people, and that being part of a specific group does not necessarily mean one is going to have poor health outcomes just due to that identity. So a little bit of demographic information. 95.6% of Pitkin County residents identify as white. Broken down a little bit further, 85.7% identify as white and non-Hispanic, and 9.9% identify as white and Hispanic Latinx. Overall, 10.9% of Pitkin County residents identify as Hispanic or Latinx, and 9.4% identify as lesbian, gay, or bisexual. Next slide, please. So the data on this slide is from the US Census Bureau using 5-year estimates between 2010 and 2020. And so you can see that during that time period, the median home value in Pitkin County decreased by 10%. At the same time, it increased in the state of Colorado by 56%, but Census data does have a lag, and I know that many of you are probably thinking this does not reflect like the current situation of housing today, which is true. So on the next slide, I have some data from Redfin that shows really what's going on currently in our community. So between June of 2021 and June of 2022, the median home price in Pitkin County increased by 37%. And in June of 2022, the median price was a little bit over $2.7 million. And in Colorado, the median home price increased by 12%. Next slide. Housing came up a lot as well in the key informant interviews, in those conducted both by students and the Pitkin County community contractors. So we heard a lot about how the high cost and low availability of housing is a big concern. In the interviews conducted by the students, the participants mentioned that housing was one of the 3 social determinants of health that are of the greatest concern in our community, with the others being access to healthcare and wealth disparities. And I included this quote. I really liked it. It summed up a lot of key informant interview participants' thoughts about housing. There's not a lot of affordable housing options for people, and it's pretty hard to live and survive here, even making decent money. Next slide, please. So switching gears a little bit to talk about the national environment and climate change. So between 1895 and 2021, the average temperature in the state of Colorado has increased by nearly 12%. And so that blue line is the trend line showing how that has changed. And even though some years the average temperature might be higher, or the temperature that year might be higher than average, or others might be lower, overall the temperatures are fluctuating around a warmer point, showing the general trend of getting warmer. So far, 2022 has been the 6th warmest year in the state of Colorado on record. And the number of frost-free days, or the days where the temperature does not drop below 32 degrees Fahrenheit, has increased from an average of 74 in the 1940s to an average of 120 in the 2010s, and that is a 62% increase. Next slide, please. So these are a couple of the photos that came out of the Photo Voice project. I intentionally did not include the write-ups just because that'd be a lot of words and it's hard to read and listen. So I'm going to summarize what the photographer said about these. So the picture on the left shows an airplane at the Aspen Airport. And the person who took this explained that there's a high ratio of private to commercial flights in Aspen, which results in a high carbon footprint as well as wear and tear on the infrastructure. And even though this mode of travel is expensive, it doesn't deter people from doing it. So what they suggested was to charge an additional fee on these private flights and then use that money toward a climate control program or environmental project. The picture on the right shows produce and net produce bags. And the participant noted that the grocery stores use single-use plastic bags for produce, which is wasteful and harmful for the environment. And they suggested expanding upon a already popular program of reusable grocery bags to also include these net produce bags. And to achieve that, they suggested a few different things, including subsidizing the cost of these bags, gifting the bags to residents and eventually guests in the community, and providing coupons for rebates on produce purchased when these bags are utilized. Next slide, please. All right, so looking a little bit at income in our community. So these graphs show the median income in both Pitkin County on the left and Colorado on the right. So in Pitkin County, the median income is about $82,000. White households earn more than the median income, about $85,000 in both multiracial and Hispanic and Latinx households earn approximately $20,000 below the median income. And the trend is similar in the state of Colorado, with white households also earning above the median income, in multiracial, in Hispanic and Latinx households earning below the median income. Next slide, please. So next, I wanted to share some statistics with you on access to care in our community, specifically around health insurance. So in both Pitkin County and Colorado, 1 in 10 adults do not have health insurance. In our county, 1 in 10 children don't have health insurance compared to 1 in 18 in the state. Next slide, please. In Pitkin County, 1 in 11 children who are eligible for Medicaid or CHP Plus are not enrolled, and this is in comparison to 1 in 15 in the state. And in Pitkin County, 1 in 3 working age adults who are eligible for Medicaid are not enrolled, and this is in comparison to 1 in 8 in the state of Colorado. Next slide, please. So while health insurance is definitely an important component of access to care, it's not the only thing. Other important things include being able to access services in one's preferred language, as well as being able to afford services, whether or not they have insurance. So Pitkin County Public Health did a community mental health assessment last year. The report is not publicly available yet, but that included a survey of mental health providers in the Valley. And of the mental health providers surveyed, only 14% responded that they provided service in Spanish, and more than half of those surveys accepted only out-of-pocket payments. In addition, most providers charge between $101 and $200 per hour. And in the community member survey, as well as the provider survey, the number one reason that people did not seek mental health care when it was needed was cited as finances, and just not being able to afford it as a barrier. And this is something as well that came up in the key informant interviews. Some of the people who talked about mental health said that it was expensive to access services. Next slide, please. However, I did want to highlight some of the good things going on in our community, give you something to be proud of and be happy about. So this photograph is from the Photo Voice Project. It's the reception desk at Mountain Family Health. And the person who took this photo talked about how the staff there is bilingual and how the signs there are in both English and Spanish. In both languages, the text or the font size is equal. And so it's easy to be able to pick out the information that you want depending on your language. So just pointing out that this is an asset in our community where English and Spanish speaking people can access health services and communicate effectively. Next slide. Switching gears again. So the next 2 slides are from the Healthy Kids Colorado survey, looking at mental health, particularly in those in different gender identities. So the data here is from Region 12, not Pitkin County alone, only because the small sample size of Pitkin County, but Region 12 includes Pitkin, Eagle, Garfield, Grand, and Summit counties. So in this first graph from the Healthy Kids Colorado data, you see that Region 12 high school students who identify as genderqueer and non-binary, transgender, or unsure of their gender identity were more likely to attempt suicide in the past 12 months than their cisgender peers. And overall, 6.8% of Region 12 high school students attempted suicide in the last 12 months. Next slide, please. And when looking at feeling sad and hopeless, approximately 4 out of 5 Region 12 high school students who identify as genderqueer, non-binary, transgender, or unsure of their gender identity felt so sad or hopeless almost every day for 2 weeks or more in a row during the past 12 months that they stopped doing some usual activities. And this is in comparison to almost 2 out of 5 Region 12 cisgender high school students. And overall, 41.8% of Region 12 high school students reported this, which is still a really high number, but even higher in gender identities other than cisgender. Next slide, please. So these photographs were also part of the Photo Voice Project on mental health. The picture on the left shows an intersection where on one side there is affordable housing, and on the other side there is a golf course. And the picture on the right shows a Bentley in line with otherwise modest cars. And the person who took these photos explained for both of them that there's a lot of wealth disparities in the community, especially in Aspen, and they're really easy to see. And that these wealth disparities really affect people's mental health. This was also a huge finding in the key informant interviews. When the community member who interviewed others asked them what came to mind when they thought about mental health, almost all of them talked about wealth and economic disparities, especially the cost of living and the cost of housing. Next slide, please. And finally, the last data slide I'm going to go over. In Pitkin County and Colorado, the top 5 causes of premature death or years of potential life lost are the same. What really stands out is that unintentional injuries and suicide are much higher than the next 3. The overall top 3 causes of death, so not just premature death, but all death, are cancer, heart disease, and unintentional injuries. The life expectancy in Pitkin County is 92.5 years compared to 80.0 years in the state of Colorado. Next slide, please. All right, so just want to iterate again, this was a very quick snapshot of the data. There's a lot more in the full report, but the chart shows areas where we have good health, but also where improvements can be made. And so based on the information above, as well as the information in the full report, the following areas stand out as where the greatest health needs in our community are. These are access to healthcare, mental health, housing, racial and economic equity, and climate change. Next slide, please. So plans moving forward over the next couple of months, we are planning to continue partnering with the Colorado School of Public Health students, taking the community health assessment class in the fall. They actually began, I believe, a week or 2 ago. And so with our guidance, we'll work with the students, excuse me, to conduct a capacity assessment of the service organizations of Pitkin County and the Roaring Fork Valley to address the community's greatest needs, and work with those service organization leaders as well as community members to narrow down the focus areas to a manageable level. This will be determined by the capacity assessment. And finally, working with service organization leaders and community members to develop the final public health improvement plan, or PIP. And while building a plan, and really throughout the entire process, we will integrate equitable strategies in order to ensure that all community members benefit and not just some community members. Next slide. And then to achieve this, so we will provide warm handoffs between students and our partner organizations to facilitate communication about conducting a community capacity assessment and prioritizing issues. So there's not any cold emailing going on, and just making that communication a little bit easier. And so working with the students, we'll conduct the capacity assessment virtually due to limitations of both COVID and the geographic distance. Because the School of Public Health is in the Denver area, the students can't really pop over quickly for activities, so doing it virtually will be easier for them. Working with the students, we'll conduct prioritization and develop strategies virtually again due to the same limitations. And in this process, we will involve service organization leaders and community members. Service organization leaders have more of that expertise and just a broader bird's eye view of what's going on in the community in these areas, but the community members will be able to tell us what kinds of strategies work for them and provide their input as well. And so the work completed over the next few months with the students will serve as the basis of the PIP, which we hope to have finalized by March of 2023. Are there any questions for me?
Great. Thank you, Ariel. There's a lot to that, and I apologize that we're in a bit of a rush because our budget conversation probably went over a bit. So thank you for that presentation. It's good to know. It's interesting to know that they're in the community working, doing this assessment. I didn't know about that. If we have any questions, I'd love to have quick questions. Otherwise, we need to move on and try and get ourselves back on budget, and Carly can do that, I think. We'll see. But I don't want to stifle any conversation here if anybody has anything. But I'm going to keep it moving. Okay, moving on to Carly, and then also Jordana says her section's pretty short. So I think we'll pick this up. Thanks.
Greg, I appreciate it. And thank you to everyone here for having me. I just wanted to give a really brief kind of update on the COVID response, where we are with COVID, and then just a brief introduction on what Pitkin County and Pitkin County Public Health is doing to respond to the monkeypox outbreak. So next slide. Thank you. So we're fully committed and in this kind of downshift in the COVID response towards the idea of COVID as an endemic communicable disease. And so we hear it all the time. We want to kind of move into the space where it's just like the flu. So there's a few areas where it is just like the flu, and then there's a few areas where it is not. So just kind of wanted to give a brief little snapshot on what COVID is doing right now and kind of highlight those similarities and differences. So the current predominant variant circulating globally, as well as in Pickens County, is BA.5. It is a sub-lineage of the Omicron variant that we saw emerge last year in the winter, November and December. And so BA.5 is by far the dominant variant now. We also are seeing BA.4, which is another Omicron subvariant, circulating as well. So these two often, they're very closely related. So they are often lumped together in analysis. They have very similar, presentations and transmissibility. So this is the current phase that we're in. This began in roughly June of this year. And it's kind of held steady throughout the entire summer. So BA.5 at its peak back in June, July was 10 times deadlier than our average and typical flu year. So in this way, when we say that it is just like the flu, it is and it is not, right? We are seeing higher death rates, particularly for individuals who are unvaccinated and individuals who are already predisposed to negative outcomes due to COVID-19 infection, such as being older or immunocompromised. And so to some degree, many people will come out of COVID and be perfectly healthy, but there is still a high amount of risk to individuals who are who are at higher risk of those negative outcomes. We can really see this in a report that was released last 2 weeks, that there has been over the last 2 years a steep decline in life expectancy within the United States due to COVID-19. So before the COVID-19 pandemic in 2020, the life expectancy in the United States was roughly 79 years of age. And now, last year, it took a decline to roughly 77 years of age. And then this year took a further decline to be right around 76 years of age. And all of this just highlights the deep impact that COVID-19 infections have on those individuals of higher risk. So in that way, we see a very different situation than we do with the flu. What we see kind of in the similarity aspect is as we move towards the idea of this being an endemic illness that we all are that as a country, as a community, we know that we are learning to live with and deal with on a day-to-day basis, is really this shift away from mass communal efforts to control the spread of COVID-19 towards this idea of personal protection and personal mitigation strategies. And so that goes from the mask mandates that we all are full aware were effective and worked over the last couple of years, more towards individuals masking to help protect potentially at-risk individuals in their households, or businesses or medical providers choosing to maintain mask mandates within that space in order to protect themselves due to that higher risk of exposure. And so the shift towards individuals getting to make choices based on their own personal risk assessment and the risk assessments as it pertains to their loved ones and ones that they come into close contact with. So I think a big takeaway from this is that each individual should assess their own risks, make smart decisions as that pertains to themselves and what they are comfortable with the additional ask to always be aware of those individuals in your life who may be at higher risk of those negative outcomes, and taking extra precautions to protect them is always going to be the best community effort that we can have nowadays. We also have the seasonal vaccination effort. I'll talk a little bit more about the recently approved vaccines in the next couple slides, but vaccines and vaccinations continue to be our strongest tool at reducing these negative outcomes due to COVID-19 infections. So even though we've seen the virus mutate and become more transmissible and through its ability to kind of evade our immune response, we know that vaccines throughout this entire endeavor have been incredibly effective at reducing hospitalizations and severe illness. And then these new bivalent and these new reformulated vaccines are just that much more protective. And I feel really fortunate that we've got that approval out so quickly. And so Another way in which this is kind of shifting towards a very similar process and similar response to the seasonal flu that we see is shifting away from these mass federal and state sponsored programs. So a lot of you might be familiar with our free testing sites that are available at the Aspen Airport through Affinity or the mass vaccination, the CDPHE mobile vaccination, bus that comes to town every few weeks. As we see a lot of that support getting withdrawn from the state and the federal government, this is going to shift into the response, and those level of operational activities, testing and vaccination, are going to shift towards medical providers. And we haven't had the need for that thus far. We know Aspen Valley Hospital has been an incredible partner in offering vaccinations to their primary care. They've always been testing providers, but really looking towards our medical community to try to pick up some of this slack and assure that testing is available to their patients and assure that vaccination is available to their patients once these public efforts come to an end. And then the graph below, I'm sure most of you are very familiar with, is just what our incidence rates look like within Pickens County, starting with that Omicron surge all the way to where we are now. So we can really see how dramatic a shift we've had from the winter into this summer process. And currently we're sitting right below 100 incidence rate. We're right at 80 today, if I remember correctly. And so we really have seen this downshift in individuals seeking testing, in the severity of cases, and all of that's very positive. So I just wanted to kind of bring this up to look at the scale at which we're seeing COVID cases and the need to respond really change from that winter space into this summer and early fall space. So next slide. And then just really briefly wanted to touch on two terms and two sort of off branches of the COVID response that have been floating around and are going to kind of continue to be important factors as we look at how do we support the community as far as COVID-19 is concerned. So the first one is rebound COVID, and these are two distinct terms, two distinct kind of conversations, but I hear them kind of confused periodically. So rebound COVID is when an individual is prescribed a antiviral pill by their medical provider, and then upon completion of that medical treatment, they then see and experience a rebound in COVID-like symptoms. And so this happens in roughly 5% of individuals who are prescribed these two different medications, and hospitalization occurs in roughly 2% of the individuals who take this medication. This is not a fault of the medication by any stretch. This is it's always been a risk that once that antiviral medication wears off in your system, that the virus can sort of rebound and kind of those symptoms can resume. But this can happen, and that individuals who are COVID positive and seeking medical treatment, and especially those who are at high risk, truly should take these medications. This isn't a downside. This isn't a side effect. It is just sort of what can sometimes occur throughout the natural progression of the disease. And so these two medications are still incredibly effective at reducing hospitalizations and, again, those negative outcomes due to COVID-19. But it is something that can occur, and that if individuals who are on this medication are experiencing rebound COVID, they can please go speak to their medical provider to make sure that they are as healthy and make a quick recovery as possible. So rebound COVID is specifically in light of these two medications that are prescribed to high-risk individuals. This is not to be confused with long COVID. Long COVID is something that we are seeing more and more about. The CDC released a study last month that a state found that over 20% of individuals who have that have been contracted COVID do suffer long COVID symptoms. There is no single cause or risk factor for long COVID. There's a few different theories on why long COVID persists in some individuals. The three main the three areas that have the largest support for causing long COVID symptoms are autoimmune system dysfunctions, blood clotting dysfunctions, and chronic recurrence of latent COVID infections, and that each of these three might hold a piece of the puzzle. It's likely that there's not one reason that's causing long COVID in all individuals. It's likely that it is an amalgamation of all three of these factors, if not more, leading to presentation of really diverse symptoms that are all lumped all lumped in to the term of long COVID. At this time, there is no single cure. It is a lot of symptom management. That being said, there is a lot of studies going on right now. There's a lot of work going on through a lot of different organizations nationally and globally to see if there are cures that will alleviate these symptoms long term. But this can be truly debilitating. This can be ranging from chronic fatigue syndrome, which is leading to people's inability to actually return to work, all the way to chronic lung congestion, shortness of breath, brain fog, as we hear a lot due to long COVID, and that a lot of these can range from very, very mild to incredibly severe. And so I think going forward, this is going to be a huge area of study and a space that more attention needs to be paid to. Our medical providers can help assist patients potentially presenting with long COVID symptoms, and that as we go forward, treatment options will become better and better as these studies and as more information becomes available. So just wanted to touch on those super briefly. Next slide, please. And the very exciting news, the good news. So our reformulated bivalent vaccines, AKA our updated boosters, were approved late last week. So both Moderna, which was approved for individuals 18 years and older, and Pfizer, which was approved for individuals 12 years and older, have both been approved. Both are bivalent vaccines, which contain both the original wild type COVID virus as well as BA.5 strain. And this is really in an effort and was decided by the FDA way earlier this year in an attempt to sort of proactively protect against any future variants, as well as the current dominant variant that is circulating. Efficacy data is not yet available from human or real world studies. So the visual on the right-hand side is from the submittal to the FDA for approval, and it was done in mice. But what it ultimately shows is that this new bivalent vaccine really does show strong protections, not only against previous variant types, i.e. wild strains or Delta or Alpha, but also currently the Omicron strains that we see circulating now, which is the BA.4 and BA.5. The hope here is that any future variants that do evolve, whether it be from that Omicron lineage or from even a historic lineage before that, that these bivalent vaccines could be effective against any new future variants. And now that we have the technology and the wherewithal to know how to reformulate that vaccine, it could be done relatively quickly, and a really big shift towards this idea of an annual vaccination effort akin to the flu vaccination effort that we see every year. So that's kind of how the process came about. Current eligibility is anyone above the age of 12 who has already received their primary dose series. This cannot be administered as a primary dose series. So if you are not yet vaccinated, individuals will need to go seek out that initial vaccination and then seek the booster in the appropriate time. And anyone who has already received their vaccine, their primary dose vaccines, is eligible 2 months after receiving their last dose. So even if individuals have already received one, if not two booster doses of the original vaccines, 2 months after their last date, they can go sign up and make an appointment for this bivalent updated booster. Availability, local physicians are offering this in individual offices, so give your physician a call. If they are a vaccine provider, they can go ahead and make an appointment for you. The state vaccination bus will be returning to Pickens County on September 20th, 21st, and 22nd. The dates are posted on the vaccination Twitter feed on the Pickens County website, and you can go ahead and sign up for an appointment directly through there. No insurance, no ID required. And then just a quick update on kind of, again, those ages. It's only 12 years and older who are eligible for Pfizer, 18 years and older for Moderna. And then for our 5 to 11-year-olds, we're hoping to see approvals come out by the end of the year for a reformulated booster dose for that age group. And as far as under 5 is concerned, there's no data as of now or no indication for when that approval will come through. But again, these are going to be available in Pickens County through that vaccination bus or through your medical provider. If they are a vaccine provider. But we're very excited to have these, and everyone who is eligible should go seek out their booster dose. It is going to be an incredibly effective and important tool at kind of controlling COVID-19 and reducing the risk of negative outcomes due to COVID-19 infections this winter. So next slide. And then just a brief kind of introduction to MPX, aka monkeypox or MPV. So MPX is a orthopoxvirus. It causes a mild flu-like illness followed by a systemic rash. And this rash is painful. So it's not a passive rash, it is very active. Individuals who have it know that they have it. Transmission is through various methods, but predominantly it is through skin-to-skin contact with those infectious lesions of that rash stage in the disease. It can also be transmitted through contact with clothing or linens that have been soiled by an infectious individual. And it's possible that there is transmission through salivary droplets in the air. Excuse me, but that risk seems to be much lower, and we're just awaiting data to definitively say how large that risk is. There are roughly 235 cases in Colorado. I think that got updated today, so I think it's a little higher today, predominantly along the I-25 corridor. There are no cases within Pickens County as of today, but there are cases present in neighboring counties. In general, we saw an optimistic peak as a state in mid-August. But again, we are still seeing cases occur. We are still kind of hoping that, or the response is still there. We're trying to get as many people vaccinated as possible, but we have seen a reduction in the rate of increase of cases since that mid-August spike. So hopefully optimistic that we're starting to see a plateau. In order to diagnose monkeypox, an individual does need to go see a medical provider. It is not just, I always find myself comparing it to COVID-19. It's not just a swab that can be done at a drive-through. There really does need to be a full examination of an individual presenting with monkeypox symptoms, not only to potentially diagnose MPX, but also to rule out or treat any concurrent infections. MPX can present very similarly to many different illnesses, ranging from foot and mouth to syphilis. And so there's a lot of there is the need to have a medical professional and a doctor examine these patients to determine if testing for monkeypox is necessary, or in order to assure that testing for concurrent infections is also occurring. So diagnosis, individuals who believe that they have come into contact with an MPX positive individual or who are displaying MPX symptoms are really encouraged to go to their medical provider. Testing is available through the vast majority of commercial laboratories. And so any medical provider can perform this testing and submit those samples through their standard laboratory practices. Treatment is also available. This is TPOXX. It is, again, a antiviral. There's a lot of studies going on about the effectiveness and impact that TPOXX has on positive patients, but it is only available for individuals at high risk of negative outcomes due to monkeypox, due to MPX. And so typically MPX is not, doesn't cause death. There's only been one death due to MPX reported in the United States, and it was out of Texas. And so this is typically if individuals are presenting severe cases or cases presenting in high risk areas such as the face or close to the eyes. So any individuals presenting higher risk disease should talk to their medical provider in order to be prescribed TPOXX. Vaccination is also available. Jynneos vaccine has been available to confirmed high risk contacts of individuals who are confirmed cases of MPX. So these are the two programs of PEP and PEP++. So this really is truly limited only to individuals who have had that high risk contact with a positive case. And so if that is the case, individuals can reach out to Pickens County Public Health and we can help coordinate vaccination for those individuals. At this time, there is no prophylactic vaccination available in the state. So individuals who have not had contact with a confirmed case cannot receive a vaccine as of this time, but we're hoping that that eligibility expands in the next couple of weeks to allow for that prophylactic vaccination effort. As soon as that is, we are really fortunate that Community Health Services has signed up to be a vaccination provider. Any medical provider can sign up to be a vaccination provider. All that information is on CDPHE's website. And so any individual or medical practice who's interested, please reach out to me. I'm happy to help out. But it is a very simple process. And the more providers that are available when that prophylactic vaccination does become available, the better access to care those individuals who are at risk of contracting MPX will be able to resource in order to receive that vaccine. So When that changes, we will be ready to move in order to administer those vaccines prophylactically. Currently information, there is a website up on the Pickens County Public Health website. And there are community one-pagers that have been distributed with community partners, such as Aspen Out, as well as communications going out to hospitality and other high-risk professions, such as first responders and firefighters and police officers. So we're really working on communicating directly with individuals who are most likely to come into contact with MPX. And as, again, that eligibility expands, and as we see MPX kind of change and which populations it's being observed in, those communications will shift as appropriate to match the need. So I think that was all I had.
I want to just check for questions. We're going to keep moving here. Any questions? Chime in. Otherwise, we're going to switch. And Carly, thank you for that. That was a lot of information once again, but thank you for being so thorough. Back to Jordana.
Thanks, Greg. We just look to the next slide. At our last meeting, some board members had asked, how does our board compare to other boards of health in how we're composed and what we cover in our agendas? And so I just did some outreach to the counties listed here. And what you can see from this slide shows that a number of the smaller counties have their 3 county commissioners serving as their board of health. So this is an allowance made by the Public Health Act that the Board of County Commissioners in counties with a population of less than 100,000 may elect that their 3-member board be appointed that either a 3-member board may be appointed or the BOCC can designate itself. Boards of health in Colorado, in places where there are more than counties are larger than 100,000, you'll see like Mesa County and Boulder County, they're required to have a 5-member volunteer board who are appointed by their BOCC. So Pickens County, we know we're a bit unique in how we are made up. But you can see that we fall in here with all the others in terms of the other components. So meeting frequency, you'll see it, it's as the time periods between meetings are as soon as 2 times a month, up to quarterly, every other month, monthly. So that really spans the range here. The length of meetings vary based on how frequently they're occurring. So they're as short as 20 minutes if they're just kind of giving updates to their BOCC as acting as their Board of Health in a more frequent manner, up to a 2-hour or hour-and-a-half meeting with public comment. So those meetings can go even longer. The longest one I saw in Boulder County, I think, was about 4.5 hours. The topics covered are similar to what we cover. So administration, funding, policy, components, as well as community health assessments and public health improvement plans, any kind of MOUs, and then lots of updates and staff presentations were definitely included on a number of the agendas. So that was it, Greg. I just wanted to share those learnings with the board.
Great, thank you. That's interesting. Any other questions, comments? Chime in if you have something else you want to add. But we're going to keep moving. It's kind of nice to know we're in the middle there. I think quarterly meetings seem to work for the present. Certainly we don't want to go 4.5 hours, but 20 or 30 minutes won't cover it. So I think we're in the sweet spot, but any suggestions anyone has could please forward them to me or Jordana, and we can consider them. Meanwhile, if that's it for that, round robin is really next, and that's the opportunity to chime in on any topic you want to bring up. And it gives us a little window of time. We could take 10 minutes on this or no time on it and just keep moving to the end of the meeting. But if anybody has a topic they want to bring up, the one that I could start with is that I've noticed that it sounds as if a lot of the detection of disease, the focus on that has been going into the sewer systems lately, and it seems like that technology and that practice is really expanding across the country thanks to COVID. So disease tracking through sewage analysis is, I know it's something we've all talked about over the last couple of years as it was coming online, but that was just the one bit of news that I thought was kind of interesting, that this is really becoming a powerful tool. I don't know if you want to comment on that, Jordana, or anybody else does, but other than that, I have nothing else to add presently. It's nice to know, I saw that the Vax bus, it says will be here between the 20th and the 22nd of September. So if it's time for your booster, that's a good time to get in. And I'm not sure quite where they were, but I think they're in the Upper Valley. I didn't see precisely where they're going to be. Anything to add, Jordana?
Just in terms of wastewater, we know that that's going to become a more helpful tool, especially as we're seeing more home tests, which aren't being reported to us. So home tests are great because they're convenient, and if people are getting positive results, they are hopefully knowing what to do and staying home and isolating as long as necessary. And then we know that we can continue to monitor the community load of disease burden that we're seeing through the wastewater. We're having some learnings, especially in places like Pickens County, where we have large visitor populations coming in, or large events that are held where we might see really different uses of and outputs in wastewater. So we're continuing to look at that data and understand it, but we do have a lot of our local sewage treatment facilities participating, and we'll continue to monitor and learn.
Great, thank you. And then anything else about the Vax bus, 20th to 22nd, any other information? It might have been published there. I was too small on my screen to catch. I want to make sure people know about that.
Not a problem. And those are going to be, it's going to be available in downtown Aspen. It's going to be available in Snowmass Village and the old Snowmass Market on Snowmass Creek Road. And so it's going to be Upper Valley, but then they also have two other dates a little bit before. It's going to be the week before that's available in Glenwood Springs and Carbondale. And so those dates and all the information on scheduling and the vaccines that's available is up on the website. They should be carrying flu here soon as well. The CDC just released information on the flu vaccination. So individuals are encouraged to get that booster as soon as they can. And encouraged to get that COVID booster as well as their flu vaccine at the same time.
So you can go in and have a cocktail. Excellent.
Your words. Thank you, Greg.
Okay, any other round robin, any other thoughts? Chime in. And I'm going to move us toward the end here. What was that?
I just wanted to thank Carly for her presentation. And the fact that we have the bivalent vaccine here is so exciting. And I am such a supporter of it and really encourage everyone to get it.
Thanks,
So,
Dr.
yeah,
Lev.
thank you.
Thank you.
Yeah, and thank you, Carly. Thanks to everybody who presented today. There was as usual, information rich, interesting, and a lot to think about, a lot to absorb. Our next meeting date is December 8th at 1 p.m. And I think that's, do I need a motion to adjourn this meeting, or can I just call it adjourned? You'll have to repeat it.
Unfortunately, yes.
I do need a motion. Well, Linda, you're on screen. Does that mean you're making a motion? Yes. Okay. I need a second. Somebody just gave it a second, I think. I missed it if you did. Do it again.
Looks like Bill has his hand up.
Bill does. Okay, thanks, Bill. Any further discussion? Okay, gone. I call it all in favor of adjourning this meeting. Hand up. Thank you very much. Thanks for a good meeting, everybody. Thanks for hanging in there,
Thank you.
Yeah.
Jordan and staff. And we'll see y'all soon.
Thanks, everyone.
Bye.
Thanks to